Advances in genetic testing allow parents to find out their children's risk factors for disease, but should they? This week, Time Magazine's cover story looks at the pros and cons of genetic testing for kids and families. Jeff Kluger is the senior editor of Time. Welcome.
Welcome. Thank you for having me.
So what is the risk and what is the reason that parents should have genetic testing for their kids?
Well, genetic testing, this piece was written by Bonnie Rockman, one of our terrific reporters who got deeply into this. And the fact is we are now at the point at which we can intervene at the very beginning of these disease processes. We can learn sometimes decades before a disease may express itself if somebody has a predisposition to it. The problem is information can sometimes be excess information if you don't have anything that you can do with that information. We can test reliably for 2,500 different diseases, but there are treatments for only 500 of them.
So is it worth doing the testing?
Well, it's worth doing the testing if there are either cures or early interventions. If, for example, you find out your child has a predisposition to macular degeneration. Right. Now, he or she may never develop the disease, but there's no harm in making sure they wear sunglasses when they go out. Similarly, a predisposition to Alzheimer's. We know that concussion-related injuries can exacerbate Alzheimer's, so maybe no Pop Warner football for your 7-year-old boy.
Yes.
So who can get the test? How much does it cost, and how do you do it?
Well, there are a number of ways to do it. When the genome was first sequenced back in 2003, it cost $2.7 billion to do it. Now, none of us are going to do that.
Right. On a supercomputer.
On a supercomputer, right. Whole genome sequencing is now down to about $7,500 per person. Well, that's still a lot of money.
Not exactly affordable, Jeff.
Exactly. But we do also have commercial tests. 23andMe, for $99 can test for 200 different traits. The problem is, as we were saying before we went on, some of those traits are things like whether you have dry or wet earwax. Well, you can use a Q-tip for that.
But I know people, not children, but people who do not want to know if, in fact, there are certain diseases that they have a genetic predisposition to.
Right.
Like Alzheimer's.
Like Alzheimer's. And the reason is, with a lot of these diseases, there are either no interventions or minimal interventions. It is true, if you knew that you had a predisposition to Huntington's, say, well, or ALS, there is nothing you can do about that except die in as little discomfort as possible. Do you want that shadow hanging over you until you're 50 and the disease finally hits? Or wouldn't you rather live a full, happy life and then at 50 learn this sad truth?
On the break going to you, we took a shot of you and 2 children. I'm assuming they're yours.
They are both my daughters.
I'm thinking,
yes.
If they're not, what's the story with that?
Yeah, exactly.
But is genetic testing something that you think is a good idea? What are you saying?
I think it's a good idea when we are equipped to do it well. My children haven't been genetically tested, and I wouldn't do that.
You would not.
I would not do it because it would cause more worry, and that worry does a couple of things. Not only does it affect your own quality of life, it can also cause you to subject yourself or your kids to expensive and often painful medical tests that won't yield anything.
What are the challenges for doctors?
The challenges for doctors, the biggest one is the ethical one, what you tell. One of the 2 of the stories Bonnie came up with in this piece was, on the one hand, doctors who determined that a little girl had a high risk of an incurable neurogenetic disease that would hit at age 40. They chose not to tell the parents because they believed that this would inhibit their ability to get insurance. On the other hand, there was another child who had a risk of very early onset colon polyps, which can become malignant as early as age 7. Well, in this case, you tell them because there's something you can do about it.
What are doctors required to tell?
That's a gray area. They're required to fundamentally abide by the Hippocratic Oath. Do no harm. So that's the first thing they're required to think about. Will this help or will this hurt? Various professional groups are now implementing guidelines. Both the obstetricians group and the American Pediatric Association say, for the time being, no genetic testing for kids. We just don't know enough.
Have you been tested?
I have not been tested, no.
Why not?
I already know my earwax status. So.
And how is it?
It's just fine.
No, but this is the thing, when you think about genetic testing, for many people it poses emotional dilemmas, it poses ethical dilemmas, and I often wonder, is it a case of too much information? Is that a good thing?
That is not always a good thing. Look, we see this with medical students. They call it the Merck Manual syndrome. They begin to read Merck Manual and they assume they have every disease in the world because you can always find a little something. And, you know, that's why a lot of us are warned, stay off the internet. Don't start reading about diseases. You'll get them all.
Got it. Thank you, Jeff.
Thanks.